The importance of implementation research for health system in low and middle income countries.
All right, so let me start by saying that within low resource constraint settings like the LMICs that you are referring to, research or evidence actually shows that there is usually the high burden of preventable health conditions such as malaria. And this is actually due to the suboptimal uptake of available interventions or health solutions. But in implementation research, which we often look at as a solution-focused approach, research for implementation primarily seeks to systematically investigate and also understand the implementation of interventions. And by that, we seek to gain knowledge on barriers, enablers that can promote the effective uptake within specific contexts. In this regard, we have realized that implementation research has become a very useful tool within resource constraint settings where implementation of these interventions that I spoke about for specific conditions like malaria are often confronted by several challenges. Some of them can be social, economic, political, resource constraints that make it difficult for us to achieve the coverage that we need. So within those settings, a research for implementation has become very vital to help us to improve the uptake of some of these health solutions.
What are the obstacles to the implementation in the low and middle income countries?
We realize that historically, studies have had a very heavy focus on evidence that is generated through epidemiological studies or epidemiological designs, and also studies or evidence that are generated through randomized controlled trials. A lot of the times, these kinds of evidence helps policymakers for them to understand the extent of a health problem, for instance. So how many people are affected by HIV and AIDS? How many people are affected by malaria within a particular subpopulation? And also when it comes to the randomized controlled trials, they help us to know and appreciate the level of efficacy of these health interventions or solutions that are available. So if it is the long-lasting insecticide-treated nets, if it's artesunate that we are using as a therapy, what is the level of efficacy of these? Historically, a lot of public health studies or medical studies have focused using epidemiological and randomized controlled trials. But what we see is that implementation research actually promotes alternative designs. And these alternative designs would help you to thoroughly investigate context, for instance, for you to better understand the end users of an intervention and also engage stakeholders. But as we've tried to build the capacity of health practitioners in the area of implementation, we realize that because they have become very skilled and heavily focused on epidemiological designs, randomized controls designs, it becomes very difficult for them to rethink an approach or designs that can allow you to do a better investigation of your context, a better understanding of your end users, a better way of engaging your stakeholders. And we have seen that it is usually their ability to unpack what they know already for them to really appreciate the new tool that implementation research presents to them. And that has become a very big obstacle for us because especially again, when we go back to policymakers, they are a lot of the times interested in, so what is the problem? What is the extent of the problem? Can you speak to us with numbers rather than they coming in to understand the context why end users are not applying themselves to particular interventions. So I'll say that it's basically the design, the approach, the bottom-up approach that implementation research presents, which a lot of the times is not syncing well with what they already know as researchers when it comes to epidemiological designs and also randomized control designs.
The importance of IR team understanding their own skills and capacity.
When we are building the capacities of health researchers in research for implementation, the first thing we bring them to is a description of implementation research. And one of the key components or one of the key features of implementation research is that it is a multidisciplinary area. And we emphasize that so much so that for an individual who gains expertise in implementation research, they walk out of there knowing that I can only conduct an implementation research study successfully if I collaborate with others. This means that any implementation research venture should be collaborative, drawing on the expertise or diverse professions that are you can bring on board. So social scientists are key here. Even you need lab people if that is important to the questions that you want to answer. So we have realized that diversity of methodologies and engagement of various stakeholders is the hallmark of implementation research. And often this requires that researchers critically would start by assessing their own skills when it comes to implementation research, as well as the skills that they will need to garner from other experts to help them to successfully implement a study or conduct a study. So if I'm about to conduct a study and I realize that I am a good social scientist, but I need somebody from the biostats level, statistics support in the analysis, why not? Immediately, I should identify my own strengths. I should know my skills, my capacities, and then know what I cannot do and bring people on board to be able to address those gaps. We say that implementation research or research for implementation is a team effort, and without that, it becomes difficult for you to conduct successful studies. For instance, a researcher can only identify implementation research questions through interactions with practitioners who are on the ground. One area we also focus is that implementation research should be demand driven. So it means that if you want to conduct research, it's difficult for you to ignore those who are doing the implementation on the ground, the implementation of the intervention on the ground. And once you bring them aboard, then you start with the collaborative efforts. And again, it does not end there. You go through the mill and make sure that your intervention is being taken up, is being adopted by the end users. So, of course, you need to engage your community. You need to also engage your policymakers. And in that mill, in that pool, then that is where we describe implementation research as being multidisciplinary, because just one person with just one set of skills cannot achieve that.
The benefits of implementation research self-assessment toolkit.
What we have realized over the years is that because of the new set of skills that research for implementation promotes, there is always the need for you to create space for people to reflect and have an aha moment of what implementation research is. It is when they appreciate what implementation research is through an aha moment that they immediately realize that I have these skills, I do not have these skills. Actually, the next person next door to me is likely to have these skills. The next person in my networking is supposed to have these skills. We have been doing implementation research capacity building with the support of WHO TDR for almost 10 years now. However, we are always overwhelmed with the number of people who show interest in learning implementation research. Every year when you put out a call, you want to train people within the African region or across or beyond, the number of people who would say we are interested, even whether it's the MOOC, whether it's the face-to-face, it's become very, very overwhelming. What we have realized is that it has made it very difficult for us to use just face-to-face training modalities to reach these large numbers. And even before you reach these large numbers, we have also realized that people come in at different levels of competencies. So there are those who would come in having very basic knowledge of implementation research. There are those who would come in as intermediaries or like with having some appreciable level of understanding of implementation research. And there are those who come in as having an advanced level understanding of implementation research. It has become very necessary for us to think about a package that would allow people to self-assess and know that this is where I am